Hello, students. Today, the topic we are going to discuss about is hairy tongue. This is another or the third developmental anomaly we are going to cover. Firstly, it's also known as lingua villosa or lingua nigra villosa or black hairy tongue. It is commonly observed in the people with poor oral hygiene, and it is a condition of defective desquamation of the filiform papilla that results from variety of precipitating factors. Precipitating factors का मतलब होता है causes और etiologies. Okay, so इसको ब्लैक हेरी टंग भी कहते हैं, बट हेरी टंग कैन बी ऑफ एनी कलर due to or depending upon whatever you eat or whatever is the eating habit of the patient. So etiology or the cause, it is because of the defective desquamation, which means when the filiform papilla gets elongated abnormally and they are not desquamated, or due to or debrided, or they get debrided. The basic defect in hairy tongue is the hypertrophy of filiform papilla on the dorsal surface of the tongue, usually due to a lack of mechanical stimulation and debridement. Lack of mechanical stimulation means that the person is unable to clean the tongue area, because of which there is debridement and food debris is accumulated on the tongue surface, and it leads to hypertrophy of the filiform papilla. Tongue consists of different kind of papilla like filiform, fungiform, and two others. So it leads to their hypertrophy. This condition often occurs in individuals with poor oral hygiene, who do not toothbrush timely or eat a soft diet with no roughage or fibrous diet. Contributory factors include tobacco, coffee, and tea drinking. Clinical features which are seen or diagnosed on the patients who have hairy tongue. Normal filiform papilla are approximately 1 mm in length, while the people who are suffering from hairy tongue have filiform papilla which are more than 15 mm in length. It's you. Hairy tongue has been reported with greater frequency in male than females, which means it has a male predilection. And those who are HIV negative and use intravenous drugs also commonly report of hairy tongue. It's non-symptomatic and also can be caused due to overgrowth of Candida albicans, which is a fungus. And usually hairy tongue result in glossopyrosis, which is burning tongue. Patients complain of a tickling situation. Obviously, when there are so long, a 15 mm length papilla, then they'll cause a tickling sensation in that throat area or the dorsal surface of the tongue, in the soft palate and the oropharynx during swallowing. In more severe cases, patients may actually complain of a gagging sensation. Retention of oral debris between the elongated papilla may result in halitosis. Halitosis means bad breath. No racial predilection is associated with hairy tongue because hairy tongue is usually asymptomatic and benign. Bacterial and fungal overgrowth plays a major role in the change of color of tongue. Differential diagnosis can be oral candidiasis or leukoplakia or Epstein-Barr virus presence. Histologic findings, histopathological findings in hairy tongue consist of elongated filiform papilla with mild hyperkeratosis and occasional inflammatory cells. Debris accumulation among the papilla and candidal pseudohyphae is not an unusual finding, like it's also commonly found in the histologic findings. Treatment is variable. Brushing tongue with a toothbrush or tongue scraper or surgical removal of the papilla by electrodesiccation can help in the removal of hairy tongue. Thank you very much. This ends the topic.